Something we'll often hear from people is, I don't intend to fall. How do we actually prevent falls other than the strategy of I don't intend to fall? Now, I don't intend to fall is problematic from a few standpoints. One, we don't have control over whether we fall or not in the moment. We can't respond fast enough, especially if we're over a certain age. Our reflexes are not what they used to be. Another problem is if we're careful about falling, then we're actually at higher risk for falls rather than lower risk for falls, because now we're moving more abnormally, and abnormal movement tends to feed into falls. So we move more abnormal because we're trying to prevent falls, which actually increases our risk for falls. Also, if we're not intending to fall, that means we're thinking about falls, and so there's some sort of underlying fear of falling, which fear of falling in and of itself increases fall risk. So what to do about this problem? If you're worried about falling and you or your aging loved one is having a problem with balance and you're worried about falling, what can you do? The best thing you can do to prevent falls is what you do 3, 6, 9 months, 2 years in advance. That's how you prevent falls. That's how you intend to not fall, is by what do you do in advance. Start by going to your doctor, go to a physical therapist, find out why you might be at risk for falls, find out why your balance is not what it used to be. If you notice that your strength is going downhill, your energy is going downhill, all these things that are becoming problematic, your physical abilities, your thinking abilities, lack of mobility, lack of getting out in the community with your friends and family, you notice this decline, then act on it immediately and talk to your doctor, get with a physical therapist, and find out why your body is changing, why you're physically declining, and why you might be having a balance problem, rather than I don't intend to fall, as if I have control over this. Act in advance to prevent the problem in the first place. It's like every other aspect of life. It's like retirement, it's like relationships, it's like building a business, it's like securing your job. It's what you do in advance that prevents the problem from occurring. So the other thing you can do other than seeing a specialist is just remain active and physically active and exercise as much as you can. The more physically active you are, the more you exercise, the more it's going to snowball and go to an upward spiral where you're actually going to feed into an upward spiral where you'll be progressing, as opposed to that downward spiral where you're regressing. And so that way you can prevent these problems.